Okay, so I have good news for you. You do not have rectal prolapse.
Get out.
You have hemorrhoids.
Get out of here.
That's serious.
Really?
Very hard for anyone who doesn't see hemorrhoids and rectal prolapse all the time to distinguish the two.
Oh my God.
However, what I can tell you is that this is a good thing because fortunately I didn't see anything dangerous down at the bottom. Obviously you don't have a tumor or an infection, but also you do not have rectal prolapse.
Oh my gosh.
So the difference between
It does.
hemorrhoids,
It can
it's
come
coming
out a little further than that.
Yeah,
though, too.
yeah, I believe it. But what's coming out are the hemorrhoids,
Wow.
not the rectum.
Oh my God.
So you know when you're doing the laundry and you have a sock that's flipped inside out, you have to put your hand inside the top of the sock and grab the toe and flip it inside out. That's what rectal prolapse is. When the entire wall of the rectum is coming out of the bottom. That can be a dangerous problem because if the rectum gets stuck on the outside, the blood vessels that bring oxygen to the rectum can get pinched off and the rectum can die. And that's an emergency. That can kill you.
Oh my God.
You're not having that problem. So you're not going to die from rectal prolapse, and we don't need to do a major surgery to repair the prolapse.
Wow.
Meeting you, I thought that the likelihood you would have rectal prolapse is pretty low because most of the time when we see rectal prolapse, it's in like 70, 80-year-old women who had like 10 kids.
Yeah, I saw like sometimes like power lifters
Okay,
and
once
stuff.
in a while in power lifters.
That's why I was thinking from all the strain I had, but wow.
Occasionally in patients who have some sort of underlying cognitive issue where they're just straining all the time. Very uncommon in men, though. You have hemorrhoids.
Wow.
The good thing about hemorrhoids is that although they are annoying, they are not a dangerous problem. And we should tailor the treatment of your hemorrhoids to your symptoms. There are medical ways of treating hemorrhoids, procedures that I can do here in the office, and surgery. In general, I try to avoid surgery, even though it says surgery on my badge, and I love doing surgery, because hemorrhoid surgery is the most painful surgery that there is.
Oh jeez.
Period, full stop.
My grandfather had it a long time ago because he was in so much. Wow.
I saw a patient earlier today who had hemorrhoid surgery with me 3 months ago, and they are still in pain.
Oh my gosh. Okay.
If we do hemorrhoid surgery, you will hate me for 2 weeks after surgery, and then the next 2 months are not easy.
Oh God.
So I recommend trying to avoid it if we can, especially with other issues going on, since you just started a new medication and other stuff. For now, what I recommend is that we do a few things. I want you to start taking a fiber supplement, something like Metamucil or Benefiber. They're available over the counter at the pharmacy. And my office is going to give you a handout at the front desk for what to look for and how to take it. Even though constipation is not your issue, what the fiber will do is it's going to make the stool as ideal as it can be, because fiber is the most natural way to have a normal bowel movement. An ideal bowel movement is like a banana or a sausage. Comes out all at once. You barely need to push at all. You shouldn't have, you shouldn't be straining to evacuate completely. It shouldn't come out as mush. It shouldn't come out like hard rocks. And ideally once or twice a day. The other thing that I want you to try is really not to push when you go to the bathroom, because it's the pushing that's causing it to come out. Right? A useful technique is actually to get a footstool, or there's something online you can buy called Squatty Potty.
I had got that
Use
a
it.
long time ago because I thought it was.
Yeah. So what you're basically doing then is you're propping your knees up to go to the bathroom, which, just like you were showing me there when you're sort of bent over like this, it changes the angle of the rectum and makes it easier for the poop to come out. Those two things might help to reduce the swelling of the blood vessels, because all that a hemorrhoid is a swollen blood vessel on the inside. That's what this is. But it's gotten so swollen that when you're pushing the hemorrhoid out in addition to the poop.
Oh my gosh. Yeah, I can't really poop without it coming out at all.
Right. So I want to try these two things, the fiber and the Squatty Potty,
Okay.
to see whether that makes a difference.
Okay.
Medications, preparation H, suppository is not going to make
That's
a
not gonna
difference.
do it. Yeah, that's only if I'm in pain or something.
Yeah, but they're not going to do a
Wow,
whole lot.
I
It's literally
can't-
money down the drain.
You know, I don't know if this. When this first happened, I
Yeah.
took a picture.
Yeah.
I don't know. Is that something I
You
can?
have it, sure.
It'll take me a second to scroll back, but I should be able to. I'm sorry. I don't know if that could help anything. I just thought about it, but
I
let me
mean,
see.
it'll confirm the diagnosis. If this doesn't work, I want to see you back here in 3 months.
Okay.
And that's when we would talk about surgery. I'm going to try my best to avoid, in your case, the reality is some people need surgery. But it's not an emergency,
Oh wow.
and we just need to be prepared mentally for the suffering that is going to come after hemorrhoid surgery, because that's what it is. It is not an easy recovery, and I want to make sure that you're in a place where it's okay for you to take something on like that, both in terms of work and the rest of your health. Does that make sense?
Yes. Yes.
Okay.
Yes. No. That is. That's what happened.
Yep, hemorrhoids.
That's hemorrhoids.
Hemorrhoids.
Wow. Oh my gosh. I
Yeah.
really thought I was really. I just. Oh my gosh.
It's a very
that's
difficult
amazing.
diagnosis to make unless you're a specialist.
Wow. Thank you though.
Yeah.
That really makes, because I was ready to just say, hey, let's cut my stomach or whatever they were saying with that other surgery.
Right. Fortunately, we do not need
Okay.
to do that.
Okay.
Okay, so we're going to try fiber, try not to strain as much, and I'll see you in 3 months.
Okay. Great. Thanks so
Okay.
much, Doc.
My
I
pleasure.
really appreciate
My
it.
pleasure.
That's really good
So I'm going to
news.
send you out to the front desk. They're going to give you information about what we spoke about, both about hemorrhoids and fiber, so that you don't have to remember what I said.
Awesome. Thank
I'll
you
see
so
back in
much,
3
Doc.
months, okay?
Really appreciate
All
it.
right, you welcome.
You too.